Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, psychiatrist, internist, and addiction medicine specialist. Today's Kevin MD article is How Insulin Resistance May Cause Alzheimer's Disease. Muhammad, welcome back to the show.
Thank you very much for having me to talk about this timely topic with new discoveries and developments about the involvement of metabolic aspects, both in cognitive issues as well as mood issues and anxiety issues, and specifically talking about the metabolic component in Alzheimer's disease.
All right. For those who didn't get a chance to read this article, tell us what it's about.
So, Alzheimer's disease is part of the cognitive disorders that affect individuals as they age. It's a ruthless disease that robs us of the essence of our identities, the memories, the ability to process, executive functioning, the ability to live an independent life. It is thought initially that genetics contributed significantly to the development of Alzheimer's disease and cognitive disorders in general, but our research over the past 10 or 15 years really suggests that there may be a significant metabolic component to Alzheimer's disease. And we talk about Alzheimer's as actually a metabolic disorder, and we call it even type 3 diabetes. So these are very, very important concepts that are developing and that can help practicing clinicians out there to basically be able to modify some of the risk factors that a lot of our patients experience.
And for those who may not be familiar with the data, those with metabolic syndrome or diabetes, in a ballpark range, how much would that increase their potential risk of Alzheimer's?
We're thinking more like 3 to 5 times.
Wow.
So significantly, exponentially increase the risk. Now, basically the whole concept goes back to the cellular components. So as you know, insulin, which is the hormone that controls sugar and glucose metabolism, it's more like a key that allows glucose to penetrate into the cell. And if we remember from our days of biochemistry, and we've actually gained significant understanding of that, the insulin receptor in the cell actually is interconnected with both the dopamine receptors and the serotonin receptors. So any disharmony or any difficulty in terms of metabolism, if the insulin receptors, there's insulin resistance and it doesn't allow glucose to enter into the cells, the dopamine receptors and the serotonin receptors are also disrupted. But basically, what happens is in diabetes, which
Hmm.
is a complex disease, there is some component of insulin resistance, which does not allow insulin as a hormone to affect the insulin receptor and allow glucose into the cell, starving cells in the brain as well as the rest of the body of glucose and leading to this significant metabolic issue that happens in Alzheimer's disease. And basically, also affects both the dopamine receptors and the serotonin receptors. So we see that significantly, and that kind of accelerates the development of cognitive issues, and specifically Alzheimer's disease, as well as other forms of cognitive issues such as vascular dementia
Hmm.
and Lewy body dementia.
And as far as you understand from the research, are these effects permanent? Are any of these potential risks reversible with better blood sugar control?
Sure. So basically, the main component, what happens is in Alzheimer's, in the case of Alzheimer's, the main part of the brain that is affected is the hippocampus,
Mhm.
which is basically the memory unit in our brain. And it is very, very densely populated with insulin receptors. Has also a lot of dopamine receptors and serotonin receptors. But basically, when the brain is starved, basically we lose our memories and we lose our ability to have executive functioning and we lose our ability to process information. So there's the memory loss, the loss of the ability of executive functioning. We are finding that actually when we start to modify some of those components, some of those risk factors that are there, that they may be a positive result of that. And in the article, I talk about a hypothetical
Mhm.
visit where a patient may visit their physician and they're found to have insulin resistance and they may have also high blood pressure or other things and basically may have a genetic component that predisposed them to Alzheimer's disease. And I talk in the article also about some of these genomic testing. And so basically, currently, or maybe in the very, very near future, the physician would say, listen, you have high risk for dementia with this genetic component. You have insulin resistance. You have high blood pressure. We need to act now to be able to modify these risk factors, especially if the person is at age 40 or age 50. So instead of Alzheimer's or cognitive issues developing at age 60 or 70, they're pushed
Mhm.
further in life, or they may not develop. They may be averted altogether. But we have to start acting very, very soon, very, very early at age 40 or 50, specifically for individuals who have risk factors with diabetes,
Mhm.
with genomic factors that predispose individuals to Alzheimer's. So acting very, very early is very, very important.
And in terms of potential management or treatment strategies, are they simply the traditional ways that we manage blood sugar control or treat diabetes? Anything specific as it relates to that connection between diabetes management and the risk of Alzheimer's?
Sure, sure. So the traditional management, which is the lifestyle interventions, exercise, remaining active, remaining cognitively active, can help with protecting neuronal integrity and can help us really push the development of basically Alzheimer's disease and may actually improve the insulin sensitivity and the ability of insulin to kind of modify these things. Because what happened is when there's insulin resistance and the cells are starved of glucose,
Mhm.
what happened is that those harmful amyloid plaques that we study about and that we see basically develop in the brain, in the hippocampus, as well as other parts of the brain. And those are basically manifested with memory loss and loss of executive functioning. So basically, lifestyle modification, modification of risk factors, diet, exercise, really kind of just the main things that we do that support this concept that we are modifying these factors very, very early. Remaining active is very, very important. And we see that actually these simple factors have the highest impact in
Mhm.
terms of delaying the progression of cognitive issues. It's not medications, it's not these expensive vitamins or supplements that people take. It's actually those simple modifications, lifestyle modifications. Now there is a role for medications, and now these sexy GLP-1s are kind of being involved with that and basically are thought to be something that would be employed and may actually push further the risk of developing cognitive issues to later in life, if not averting them completely.
Now, where does this leave traditional Alzheimer's treatments like cholinesterase inhibitors, given this potential connection with metabolic syndrome and Alzheimer's? Do they still have a role in potential management of Alzheimer's?
I mean, there's still some role to them. Their effect is modest. They delay the progression of cognitive issues by few months, the cholinesterase inhibitors. And so I think donepezil, rivastigmine, and galantamine, they have some role once the issues are realized and they're spotted and we see that they're happening. They may delay the progression somewhat, but their effect is very modest. The most impact, the interventions with the most impact are lifestyle modification, diet
Hmm.
modification, exercise, remaining cognitively active. But there may be in the future, as we do more research on these newer agents that are managing diabetes more effectively, we may find that some of these agents may have a little bit more impact than what we thought before, and we may be able to deploy them a little bit more effectively to prevent development as well as progression of cognitive issues in Alzheimer's and in memory issues.
In your article, you mentioned some newer tests, blood tests that can potentially predict whether one may be struck with Alzheimer's? Talk about some of these newer tests that's on the horizon.
Sure, sure. There's now a couple of tests that are FDA approved, cleared, that combine basically looking for different components of the amyloid proteins, the beta amyloid proteins in the blood. And basically you can do a blood test, and you can do a ratio of these different proteins in the blood, and the FDA approval has been basically granted that there have a significant positivity in terms of being able to predict whether a person is at high risk for developing Alzheimer's disease. And so actually we've seen news about actually some actors and celebrities being tested and
Hmm.
finding out that they actually are at high risk for developing cognitive issues and Alzheimer's. And they've actually decided to step back from their job or their acting career just to spend more time with family because they find out that they are actually at high risk for developing Alzheimer's. So these tests are really making an impact on a person's decision about what to pursue in life and whether they're going to basically work hard on modifying some of the risk factors, such as the diabetes, such as lifestyle modifications, if there's any vitamin deficiencies, remedying that, as well as nutritional factors that are
Hmm.
very, very important. So we've seen that some of these tests that got approved in the last couple of years, they're making valid impact on people's decisions in terms of what they do in life and lifestyle modifications.
We're talking to Muhamad Aly Rifai, psychiatrist, internist, and addiction medicine specialist. Today's Kevin MD article is How Insulin Resistance May Cause Alzheimer's Disease. Muhammad, as always, let's end with some take-home messages they want to leave with the Kevin MD audience.
Sure, sure. So the message I think is clear, and it is urgent. Alzheimer's does not have to be inevitable. It can be prevented, it can be managed, and perhaps in the future we may be able to reverse it by embracing its metabolic underpinning. And basically, primary care doctors and psychiatrists and neurologists with their patients can foster awareness, advocate for early screening, and prioritizing the metabolic aspect of cognitive issues so we can reclaim our memories and continue with a better quality of life as we age.
Muhammad, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure. Thank you.